Variola or more commonly known as smallpox, consists of two variants of the virus, variola major and variola minor. Variola minor is the less deadly form of smallpox, killing around 1% of its victims, whereas variola major has a much more devastating effect, killing 30% of its victims. The variola virus is a large spiked brick-shaped cell consisting of a double cell wall coated with surface tubules. On the inside of the cell there is a lateral body, a palisade layer, and the core. The variola virus attacks the individual cells and hijacks the cell's reproductive mechanism to produce millions of variola viruses until the cytoplasm is full. It then explodes, causing a smallpox bomb, which spreads to all the other cells in the body. If enough of these cells are destroyed in a single organ, the organ will shut down, and then all the body's systems may start to shut down afterwards. The reason variola major is so deadly is due to its ability to evade the host immune response and avoid activation of the immune system and complement formation. There is a lack of scientific evidence to explain exactly how the body responds to smallpox. However, scientists have discovered that smallpox creates a protein that binds to interferon gamma cells, which speed up the immune system to destroy viruses. The viral protein that binds to interferon gamma immobilizes it and stops it from aiding the immune system to find and destroy the smallpox virus. Smallpox can be transmitted in many ways. The virus can be transmitted through the air by droplets that escape when an infected person coughs, sneezes, or talks. Airborne viruses can spread further through the ventilation system in a building, infecting people in other rooms or on other floors. Smallpox can be spread indirectly through contact with contaminated clothing and bedding, and although the risk of infection from those sources is less common, the risk can remain long after the initial contact, as the virus can lie dormant for months. After transmission, there is an incubation period of 7 to 19 days before any signs and symptoms appear in humans. Early symptoms of high fever, head and body aches, and vomiting are followed by the most contagious stage of rashes in the form of small red spots in the mouth and the tongue, followed by a rash covering all over the skin. These small red spots fill with opaque fluids with a small dent in the middle. When the host immune system finally kicks in, the sores become hard and round pustules, and they begin to scab after a few days. If the host's immune response kills the entire smallpox virus, the scabs will all fall off, but people are left scarred or even blind. This whole process takes around 3 weeks. Scientists have been trying to figure out a way to reduce the mortality from diseases all around the world, but it all started with the smallpox virus. For thousands of years, people have been stumped by this virus. It killed Ramses and wiped out most of the Egyptian population. However, small villages in India and China used the first known form of vaccination, called variolation. The leaders of these towns used to use dried blood or dried scabs of a victim who had the variola minor, and would either cut the patient with a knife infected with the variola minor or blew it up their nose of the patient. Once doctors saw this technique being used, they started to use it, making 3 or 4 cuts in the patient's arm to inoculate them from smallpox. However, this technique still killed 3% of its patients, so was not practical in eradicating the disease. In steps Edward Jenner. He overheard a milkmaid saying that she would never get smallpox as she had already been infected with cowpox. Jenner realized that cowpox was closely related to smallpox, however it was milder and the patients recovered within a week. On May 14, 1796, Jenner tested this on an 8-year-old boy, James Phipps. He injected the boy with a dose of cowpox and then waited until he recovered. 3 weeks later, he injected the boy with smallpox and witnessed that the boy never caught the disease. Even though his test was successful, it took society a long time to accept it. Once accepted, though, millions of vaccines were created and shipped all over the globe, where doctors vaccinated entire towns surrounding outbreaks. 180 years later, the last known case of smallpox occurred, and vaccination had eradicated this disease, a world first. Some diseases are too fast and deadly for the immune system to act and produce enough antibodies to fight the disease. This is why vaccinations, using much less harmful forms of viruses, are used. A vaccine uses a less harmful form of a pathogen to trick the immune system. Lymphocytes produce T and B cells, which rapidly undergo mitosis, creating millions of T and B cells a day, and kill the pathogen that is spread into the body. The memory B cells remember this strand so that if the more harmful form of the disease gets past the first line of defense, these antibodies are ready to attack and kill the harmful pathogen. Public vaccination programs have been implemented, which allow the immune system to produce B and T cells needed for when the real pathogen enters the human body. This public vaccination against the disease also stops the spread of the disease to other towns or cities and decreases mortality. In poorer countries, public-funded vaccination programs allow widespread vaccination amongst poor communities. The vaccination of diseases such as polio and diphtheria were very effective, but did not completely eradicate the disease. Polio vaccines use inactive poliovirus to allow for B and T cells to be produced so that the patient becomes immune to the active poliovirus. However, there are still cases of poliovirus around the world where live polio has been given to patients accidentally. Despite these accidental live infections, since 1997, polio has declined rapidly from 8,000 cases per year to less than 10 cases per year, still a huge success. Diphtheria has almost been eradicated. In the USA in the last 20 years, only 5 cases have been reported. However, in poorer countries, a lack of money and resources for vaccinations mean diphtheria is still a large problem. Since vaccination programs for diphtheria were introduced, the death rate has greatly decreased from 9,000 to less than 10 per year, making it an extremely successful program worldwide.